Recognizing cancer symptoms. Hello, everyone. Today, we're going to discuss some key signs and symptoms of cancer. Recognizing these symptoms early on can make a huge difference, as early detection improves the chance of successful treatment. Please remember that not all symptoms mean cancer, but it's essential to see a healthcare provider if you experience any of these signs, especially if they persist or worsen. Why early detection matters. Before diving into specific symptoms, let's talk about why early detection is so important. When cancer is found in its early stages, it's often highly treatable. Cancer symptoms can resemble those of other illnesses, but some signs are more specific to cancer, particularly if they're unexplained and continue for weeks. If you notice these signs, don't wait. Make an appointment with your doctor, who can help determine the necessary tests. Let's start with signs involving blood, which are always a reason to seek medical advice. Coughing up blood. This could be a sign of issues in the lungs or throat. Even a small amount of blood when you cough should be checked. Blood in urine, pee. Blood in your urine might point to bladder or kidney problems. It's important to get it looked at, especially if it keeps happening. Blood in stool or poop. Blood in your stool could signal problems in your digestive tract. If it's accompanied by changes in bowel habits like constipation or diarrhea, it's even more concerning. Postmenopausal vaginal bleeding. For women who are no longer having periods, any vaginal bleeding is unusual and should be checked. Each of these symptoms can have different causes, but blood where it shouldn't be is a clear sign to see a doctor right away. Now, let's talk about lumps, swellings, and changes with moles. Pay attention if you find a lump or swelling that is new or growing, such as a lump that affects the size, shape in the breast, neck, armpit, or groin. A lump doesn't always cause pain, but can still be a warning sign. Breast lump or changes in breast size and shape. This can be a sign of breast cancer. Pay attention if you notice any new lump or changes in how the breast feels or looks. Skin sores or wounds that don't heal. A sore that stays open or gets worse could be a sign of skin cancer. If a sore doesn't heal after a few weeks, it's time to check with a doctor. Changes in a mole. If a mole changes color, shape, size, or starts to bleed, this could also indicate skin cancer. Keep an eye on moles and let your doctor know about any changes. Swollen lymph nodes in the neck, armpit, or groin that swell up and don't go down might suggest an infection or, in some cases, cancer. If you notice a lump that doesn't go away, it's worth discussing with a healthcare provider. These signs may seem subtle, but they're important indicators that should never be ignored. Certain symptoms are tied to specific areas of the body, which can give us clues about the type of issue. Persistent cough or shortness of breath. If you have an unexplained cough that won't go away or breathing issues, this could be linked to lung problems. Trouble swallowing or feeling of food stuck in chest. This sensation may be a sign of issues in the esophagus. It's essential to have it checked, especially if it's new and gets worse. Unexplained trouble urinating. Needing to urinate urgently, more frequently, or with pain can signal bladder or prostate issues. Increased belly size in women. A belly that enlarges without overall weight gain, especially if there's also pain or frequent urination, could be a sign of something like ovarian cancer. Each of these site-specific symptoms can indicate various health issues, so it's important to share them with your doctor for a proper diagnosis. Finally, let's discuss general symptoms, which may seem broad but are still important. Severe heartburn or chest pain, persistent or worsening heartburn or chest pain can sometimes indicate cancer in the esophagus or stomach. Belly pain that doesn't go away. Ongoing pain in the abdomen, especially if it's intense, can also be a sign of something more serious. Unexplained pain in other areas. Unexplained pain in places like the mid-back, head, or anywhere else should be examined if it continues or intensifies. Pain is a way your body signals that something might be wrong. See your doctor if the pain you experience is unusual for you and doesn't improve with time. Other general signs and symptoms are unexplained and severe fatigue. Persistent tiredness that doesn't improve with rest could signal a number of health issues, including cancer. Heavy night sweats. Waking up with sheets and bedclothes soaked might be a sign that something more serious is going on. Loss of appetite or lasting fullness. Losing interest in food or feeling full quickly when eating could indicate a range of health concerns. Unexplained weight loss. Losing over 10% of your usual weight without trying can be a warning sign for several conditions, including cancer. If you're experiencing any of these symptoms, it's worth bringing up with your doctor, as they could point to something more serious when they're unexplained and persistent. If you don't have a family doctor yet, there are resources to help you. Call 811 for assistance in finding a doctor. 811 nurses can also provide advice regarding the urgency of your signs and symptoms. Also, for those who are more comfortable in a language other than English, ask about interpretation services available to you.